Hi, in this video we'd like to talk about late miscarriage diagnosis and treatment. Now in our previous videos we've only talked about early miscarriage, miscarriages that happen within the first 12 weeks. By definition, if it happens within the first 12 weeks, then it's an early miscarriage. Then the other type is a late miscarriage, which is after 12 weeks. Any miscarriage that happened between these two distinct periods, this is how they are classified. So late miscarriages are not more complicated than early miscarriages. Early miscarriages are far more complex, and there are multiple factors that can cause an early miscarriage. But for late miscarriage, in our 25 years of experience, we've already tabulated there's only 4 distinct factors that can trigger a late miscarriage. Because usually after week 12, pregnancy is considered to be very stable. Rarely will have any complications, if any at all. So there's only 4 individual factors that can cause a late miscarriage. A pregnancy that is already stable, how do you cause a stable pregnancy to end in a miscarriage? We will talk about these 4 factors, but I would like to talk about one specific reason. The first factor that we'd like to talk about in this video is cervical insufficiency. Now, if you've seen the diagram here, I've drawn an enlarged image of the cervix. Now, this is directly below the opening of the uterus. Now, during pregnancy, as the pregnancy progresses, the cervix will slowly start to soften because it needs to prepare for labor, which is coming very soon, especially in the 2nd or 3rd trimester. It is probably just a few weeks away from labor. These muscle tissues here need to soften, and they will also decrease in length as to anticipate successful labor. But some people will suffer from a condition known as cervical insufficiency, which means these tissues here, they become too weak, too advancedly weak or prematurely weak, causing either, if you are lucky, it will cause a premature birth, which means the baby can be saved. The second outcome is a pregnancy loss, which means the baby cannot be saved, because for cervical insufficiency, the cervix dilates prematurely, too quickly and too fast, causing the pregnancy to exit and then causing a pregnancy loss. Now, cervical insufficiency, there are a number of causes. First of all, it is probably congenital, the most common one, which means you are born with these types of cervix. They are prematurely dilating, and you can get them diagnosed with your doctor and receive treatment before pregnancy. The next one is uterine malformation. If you have any types of uterine malformation, for example, septate, didelphys, biconioid, we've seen that these types of women will have cervical insufficiency because of structural differences. The third cause is probably due to certain types of procedures, surgeries. For example, you go for pap smear. This is where the tissue will be collected in pap smear, so it may cause some damage, some trauma. Another very common cause is that due to previous pregnancy, previous birth, previous labor, there's some birth trauma, which means there's a tearing of the cervix due to the last pregnancy. It can also cause cervical insufficiency in your next pregnancy. Now, to avoid all this, you need to do proper diagnosis, get an ultrasound with your doctor, especially if you have a history of late miscarriage. These conditions can be prevented if you receive proper treatment. Now, here at Antai Hospital, our treatment is that to prevent the premature dilation, we will actually secure a cervical ring here. We call this the anti-cervical ring. Now, it's different from conventional one because conventional treatment is that they will stitch it on your cervix. Now, this can cause some complications and also potential infection, and it's very difficult to remove after your pregnancy because it's stitched. It can cause some bleeding as well. Ours is a very flexible bio-ring that is non-reactive and there's no stitching required. That means there will be no surgery conducted. We just slip it on and it will increase the integrity of the cervix, securing you a full-term pregnancy. Antai Hospital offers a full refund guarantee, full contractual treatment for these types of conditions. If you still miscarry after receiving our treatment, then we will offer you full refund. But we have years of experience in these types of treatment, and our experience and expertise can help you have a successful pregnancy. Get in touch with us via the website today, and also leave me a comment down below.